Welcome to the European Parliamentary Research Service podcast on the economic impact of epidemics and pandemics.
As the new coronavirus spreads massively across the globe, it's not only human lives which are at risk, but also our economies and our way of life.
Trade, health, transportation, agriculture, tourism, education, no sector remains untouched. So what can the EU do in such situations? How well equipped is it to deal with the effects of epidemics and pandemics? Stay with us.
When does an infectious disease become an epidemic or a pandemic?
It is simply a matter of scale. While an endemic outbreak is something small and unusual, an epidemic is bigger and spreading, and by the time it becomes a pandemic, it is already international and difficult to control.
Unfortunately, this is the path followed thus far by the COVID-19 coronavirus, putting governments around the world under immense pressure. And while a national or regional economy is always impacted by an epidemic or pandemic, some sectors of the economy are harder hit than others. So which are these sectors?
Well, as you can probably guess, the health sector is at the top of the list. As more and more patients rush to the emergency services and are admitted for short or long-term treatment, hospitals also need to deal with increased administrative, personnel and operational costs. Sometimes these are impossible to assume without emergency financial support.
To give you an idea of the costs we're talking about, a 2017 report from the United Nations Development Programme estimated that the 2015 Zika virus epidemic may have cost as much as 16 billion euros in Latin America and the Caribbean. And while in the short term the biggest impact was felt in the tourism sector, in the long term the most substantial impact related to the health treatment for children.
Virus outbreaks, epidemics and pandemics may also put a country's agricultural sector and trade under tremendous strain. In Europe, for instance, the 1996 BSE, often referred to as the mad cow disease crisis, was estimated to have cost the UK more than €3.5 billion between 1996 and 2000.
And it's not only the countries directly affected by the outbreak which suffer. In a highly globalised world, lost trade opportunities as a result of a pandemic can affect many other countries.
That's right. And there's also tourism and travel. As people restrict their movements and as we're experiencing now in Europe, countries close their borders to prevent further contamination, the tourism industry can suffer devastating losses.
Closed tourist attractions, cancelled events, empty or closed bars, restaurants and hotels. The losses can be in the order of billions.
Easily. Remember SARS? Well, a paper estimates its impact on domestic tourism as amounting to losses of over €3 billion in China and 1.5 billion in Malaysia, and that's without factoring in air transport.
According to the International Air Transport Association, in 2003, the SARS epidemic resulted in Asia-Pacific Airlines losing 8% of its annual revenue passenger kilometres or miles and over €5.3 billion of revenues overall.
So what do we already know about the impact of the new coronavirus pandemic? Stay with us.
Well, as the situation seems to worsen by the day, it is too soon to quantify what it means for the global economy. However, considering China's increased economic clout, the effects will be considerable.
The first visible impact has clearly been in the health sector, with hospitals in Wuhan and surrounding areas operating beyond their capacity. The confinement measures have also delivered a significant blow to the Chinese travel and transport sectors, as well as the tourism industry, but the damage won't be limited to China.
As the pandemic spreads across the globe, supply chains across entire industries are being disrupted, and as China alone accounts for around half of the world's oil demand, as soon as internal demand dropped as a result of the quarantine measures, the impact on the price of oil shook oil markets worldwide.
So seeing how rapidly an outbreak can become a global pandemic, there is a pressing need for national and international preparedness measures to better prevent, detect and respond to such situations. Collaboration between countries and investments in critical infrastructures such as sanitation and clean water or urban infrastructure are also important to counter this type of threat.
So how well prepared is the EU to deal with pandemics? Stay with us.
How you organise and run healthcare systems is the responsibility of EU member states. But even if the EU doesn't have a direct competence here, it can support and complement national policies to help member states deal with common challenges such as epidemics and pandemics. So what can it do?
Well, first of all, it coordinates and facilitates the exchange of information and best practices between EU countries and health experts. It can provide financial support when needed, and it has several laws in place to protect citizens across the Union in such situations.
In the current context, for instance, the European Centre for Disease Prevention and Control is actively monitoring the spread of COVID-19. In the case of a pandemic, the EU can also accelerate the authorization processes of vaccines and medicinal products, which can help contain the spread of the virus.
To prevent cross-border threats to health, the EU supports and encourages the coordination of public health measures in order to better protect citizens and mitigate the socio-economic impact.
In this sense, the European Parliament has long been calling for better prevention and preparedness plans to deal with influenza pandemics and wants the EU to allocate more resources to research and development in this field.
In the context of the current situation, EU health ministers meeting in February and March called upon the European Commission to continue coordination on risk assessment and provide guidance on travel advice, activate funding mechanisms to support Member States' actions, and strengthen the Health Security Committee. Ministers also asked Member States to boost protection of people at risk and establish containment measures.
EU leaders, meeting by video conference on the 10th and 17th of March, also agreed to redouble efforts to limit the spread of the virus and ensure the provision of medical equipment so that hospitals don't run out of essential products such as masks, gloves or breathing support systems.
They also agreed to reinforce the EU's external borders by restricting non-essential travel to the EU for a period of 30 days. And as Italy, Spain, France, Belgium and many other European countries go into lockdown, national and EU authorities are already setting up emergency plans to support the economic recovery and ensure small and medium-sized companies don't go bankrupt.
More support measures are in the pipeline, and they will certainly grow larger as we go forward. But Europe has already learned some important lessons since COVID-19 first appeared in China at the end of 2019.
First lesson: in an ever interconnected and interdependent world, never underestimate the global economic impact of pandemics.
Second lesson, be prepared and act quickly to save lives.
Third lesson, it will happen again, so learn your lessons. You're listening to the European Parliamentary Research Service podcast.